How does a condition like Parkinson's disease disrupt the brain's intricate control over movement and everyday function? Parkinson's affects millions worldwide, yet its science remains both complex and fascinating. In this video, we'll uncover how Parkinson's impacts the brain, the early signs to look out for, and the groundbreaking research offering hope for better treatments and improved quality of life. Before I can jump into the exciting new stuff, I want to make sure everyone has a basic understanding of what's going on with Parkinson's disease. It is a progressive neurodegenerative condition, which means there's a part of the brain that's experiencing ongoing damage, and it keeps getting worse over time. It's also the second most common after Alzheimer's, and like Alzheimer's, your risk increases with age. After 60, the incidence is 1 in every 100 people. Every year, 90,000 people are diagnosed with this disease, and over 1 million Americans are living with Parkinson's disease today. It's very likely that you already know or will eventually know someone with this disease. We know that exposure to certain pesticides, heavy metals, and pollutants can increase your risk, and genetics accounts for 5 to 10% of the diagnoses, but most cases are idiopathic. In other words, we don't know what causes most cases of Parkinson's. A study in 2019 did find that individuals with ADHD were 2 to 4 times more likely to develop Parkinson's or other similar conditions. It was well designed, but it was also underpowered, so I'd want to see some more studies before I would draw any strong conclusions. Parkinson's affects a part of the basal ganglia, which sits directly on top of the brainstem in a region called the substantia nigra. This area is part of a bigger network of pathways that are necessary for facilitating and fine-tuning your movements. This part of your brain is a key production center for dopamine, which is a neurotransmitter that you might have heard of. It helps regulate our mood, concentration, learning, sleep, motivation, and critically here, movement. Without enough dopamine, a wide array of symptoms can occur that would affect quality of life. Currently, the first line of treatments for Parkinson's is a medication. If symptoms are mild, doctors might even be able to start you on a dopamine agonist like Wellbutrin or Ropinirole. Those basically trick your brain into thinking that there's more dopamine than there actually is. But if those aren't effective, the next step would be levodopa. This is a precursor to dopamine that is actually able to cross the blood-brain barrier where it gets converted to the real deal. Sometimes medications are not effective and side effects are too problematic. And up until recently, the only other medical intervention was deep brain stimulation, or DBS. This involves surgically inserting a couple of wires into that part of the brain in order to deliver a small dosed amount of electricity. It requires some initial maintenance and calibrations, but it has been a huge leap forward in treating the effects of the disease. And it has helped patients reduce their medication levels needed to manage their symptoms. Of course, I wouldn't be interested in this if physical therapy wasn't also an evidence-based approach to dramatically improve a person's mobility and function. I treat patients with Parkinson's on a regular basis, and it can't fix all the symptoms like tremors or sleep disturbances, but it is very effective. Full disclosure, like medications and brain surgery, it too has its downside. It's hard. The best evidence supports an intensive treatment schedule. 1-hour-long sessions, 4 days a week, for 4 consecutive weeks. But it really works. I have never had a patient that didn't get better, and it's always the most dramatic for those whose symptoms are the worst. Despite its proven benefits, I don't have too many patients that are particularly keen on having brain surgery. That's why I'm so excited to talk about a non-invasive treatment that was just published in a case study in 2022, and it's becoming increasingly available. Researchers in Spain were able to use focused ultrasound waves to destroy the problematic cells in the brain. Not only is this non-invasive, the patient is awake the entire time. It requires no anesthesia, and it's completely painless. A single treatment lasts 2 to 4 hours, and the effects are noticeable immediately afterwards. The biggest limitation is it can only safely treat one side of the body in order to avoid complications with things like speech and swallowing and memory. Now, if you have actually ever heard of ultrasound, I'm guessing that something like this probably comes to mind. What you probably didn't know is that you can keep cranking up the intensity on those sound waves until they have enough energy to heat up your tissues. And if you vary the frequency, you can control the depth. I use therapeutic ultrasound in my practice to help speed up tissue healing. The big difference here is the use of focused ultrasound. By mounting several transducers on a concave surface so that they all intersect at the same point, you can really get things cooking. These machines have over 1,000 beams, and the whole process is guided by an MRI. They're able to knock out an area as small as 1 square millimeter, or roughly the size of a sharpened pencil tip. And they do this without ever breaking the skin. To be clear, this procedure is permanent, and there are potential side effects like numbness and tingling and headaches and dizziness, just to name a few. But that shouldn't be too surprising anytime you go messing around in the brain. Now, if 1,000 sound waves burning a hole in your brain in order to fix it wasn't exciting enough, there is now the promise of a diagnostic test that can accurately detect Parkinson's disease. This might come as a shock, but we currently do not have an accepted imaging or lab test to definitively confirm whether or not someone has Parkinson's. It's mostly observational, with 1 or 2 clinical tests combined with a subjective report. Really, the gold standard to rule in the disease is to see if medications help the patient's symptoms. Basically, if it walks like a duck and talks like a duck and duck medications fix the problem, well, then it's a duck. But recently, researchers have been working on a blood test to detect the presence of a specific protein that is only found with Parkinson's disease and its other disease cousins, like Lewy body dementia. What's so exciting is this study also showed this protein could be detected up to 7 years before the onset of symptoms, after much of the damage has already been done. Now, even though Parkinson's is a progressive disease, and we still can't explain why this happens most of the time, early detection is a big leap forward for maintaining a high quality of life. And if you or someone you know is living with this disease, there are some phenomenal resources out there that are available. I would strongly encourage you to check out the American Parkinson's Disease Association. They have a helpline, symptom tracker app, and a diverse online community. They also have a wide network of local chapters with information and referral centers that connect people with local resources like support groups, exercise classes, and healthcare providers that specialize in treating Parkinson's. Thank you for joining us today. I'm Stephen the PT Doc, and I hope this helped.